everyone. Today we have a secondary BME students with us. So today class we are going to see the case study titled on medical regulation and standards, which is based on real life incident. So these people through this case study they are going to discuss the importance of medical regulations and standards and what will happen if medical device is not complied with these standards and regulations. So let's dive into case study. And followed by these people also giving what are the corrective measures and also the suggestion to improve or to have a proper procedure, a systematical procedure to follow the medical standards and regulation. Let's see the case study right now. Hi students, shall we start the case study discussion?
Yeah, it's nice.
So before that, please give your brief introduction about yourself, then we move on to the topic.
So hello ma'am, this is Sofia from second year BME.
Hello ma'am, this is Tavana from second year BM.
Hello ma'am, I am Risha from second year BME. Hello ma'am, this is Naman from Biomedical Engineering. Hello ma'am, I am Reshaped from Biomedical Engineering.
Yes, very good. Now we will move on to the case study discussion. Yes, you can start now.
Yeah. So hello everyone. So today our team is going to discuss a real-time case study on medical regulation and standards based on the historic medical device failure incident. So we are doing a case study on the Therac-25 Radiation Therapy Medicine Accident which occurred between 1985 and 87. So it is widely discussed in the medical safety articles and IEEE publications and also regulatory blogs because it clearly shows what happens when medical regulations and standards are ignored. In this case study, we will discuss about explain what happened and analyze why it happened, and also share our points of view and also give the solutions and suggestions for the provided case study. So my teammate will explain the case study.
Hello everyone, I am Raghunath. First we saw about what is the Therac-25. Therac-25 is a computer controlled radiation therapy machine especially used for the treatment of cancer patients. It is designed to provide a high energy radiations precisely on the cancer cells to avoid the damage of other tissues. Next, what has happened between 1985 to 1975? At least 6 people are get attacked by the radiation, massive radiation. They are experiencing the more radiations, skin burns, tissue damages, and leads to death. So the Therac-25 was speaked in most of the IEEE papers and records. We see about an example in real life. The operators entered the treatment data quickly. The system got malfunctioned and delivered the 100 times of the prescribed medicine. The patient died. From the manufacturer side, they claimed it was not our mistake, it was the operator error. But after the investigation, they proved that it was false.
So he clearly said what was about the Therac-25 incident, and he said that it was totally device fault. So can anyone tell me what actually has happened over there?
Okay, I will say the answer. So it occurs mainly due to the failure of medical regulations and standards. So major causes are lack of software safety systems and absence of risk management and lack of hardware safety controls and also poor regulation mandates. So these are the main reasons it was caused.
Yes, she also said what was happened over there, right? So can anyone give some suggestion what can be provided to overcome this happening?
Okay ma'am, now I am going to give a suggestion for this problem. The problem is based on not knowing a single error. It was caused by overconfidence in software, lack of ethical property, and poor regulatory systems. And the problems is based on the softwares and regulatory problems. And the problems solutions are high management of software, safety and user safety, and then complications, and risk management and implementation users friendly. And this was overcome by safety purpose of the systems and training errors and implementations of the softwares. That's all.
product first. Regulatory compliance must be treated as ethical responsibility. Startup and manufacturers should involve the regulatory experts earlier. Continuous post-market monitoring as essential. Now we have come to conclusion. Medical regulation exists for a reason. Ignoring standard can cause reversible damage, and technology without regulation is dangerous in healthcare. Thank you.
Yes, now we had a very good discussion about what is the medical regulation and standards and what happened if one failed to comply with this medical regulation and standards in medical device. As I used to tell that medical device is something different like other device. We have to strictly follow the medical standards and regulation. Because these are the type of device, we have to use it on the patient. So as she said, the medical, even the technology, whatever we do, without compliance of these medical standards and regulation, it's nothing, it's a zero. Ultimately, it will lead to patient life miserable. So that is the case. So whatever we do in aspect of designing medical device, we have to keep in mind that each and every design which involves in medical device, medical standards and regulation, and also we have to involve the medical experts right from the beginning, so that at the end we will have a product which can be very useful to meet the user needs, which is they are nothing but patients or clinicians, whoever may be. So this case study, I hope so it gives a great impact for the viewers to get to know how importance of